The session that I am going to present is on healthcare clusters and healthcare zones. And essentially what we want to talk about is the global environment for medical tourism. In any event, we're talking about medical tourism, which is really raising the standards of healthcare and providing services for people around the globe. Medical tourism is not only a globalized industry, but it's also regionalized. So many of you who thought about the global opportunities in medical tourism are also seeing that some of your lowest hanging fruit is in the regional markets. So you'll see within the U.S. and within the Caribbean and Latin America, there are some close ties because of the natural population flow across borders. Of course, within Europe, we have the same flow of patients traveling across borders, all of which are looking for the same quality standards. They're looking for a value proposition. That value proposition is a combination of four things. One is affordability. Many of you have heard about the U.S. market patients that are traveling because they're looking for better cost for health care. And in other areas which are have greater economies or higher market pricing for their healthcare services, those patients are still looking for value. So they end up looking for areas where they can get a better market price for their healthcare services. Additionally, patients are looking for the availability of medical services. So oftentimes there's medical procedures that can't be found within their location and can't be found within their regions. We also are looking for that raise in quality. So this has traditionally been the flow of patients traveling from one area of low quality of care to areas of high quality of care. And how that has changed as of late is that we're seeing patients travel from areas of high quality care to other areas of high quality of care. And that's what we're seeing in many of the developing regions as they raise the standards of their healthcare services. In addition to that, the perception of tourism is unique because we don't typically put medical care and combine it with the tourism element. And many people from the healthcare sector say this really just doesn't fit with us. Is it the ministries of health that need to take charge of the program? Is it the ministries of tourism? Is it ministries of economic development? In the end, we're talking about the perception of tourism is a key indicator of where patients will travel for care. They're looking for safe areas. They're looking for areas where they know that they and their family members will be able to have a good experience, particularly if they're coming for long-term care. So if my slides come up, I would show you that there are over 80 countries now that either through their governments or through the private sector, they're looking to establish a medical tourism platform. And this happens in many ways, and we're going to talk about the development of healthcare clusters in this fashion. You'll see that sometimes the initiative is coming from the government, and other times it's the private sector that is spearheading it. So for instance, in Thailand, many of you know the name of Bumrungrad Hospital. That was the initiative of that one particular hospital that seized an excellent opportunity to attract the media's attention. They had a CNN release of a patient testimonial, and it really took hold in the United States for understanding what the opportunities were in going to a country as far away as Thailand. That opportunity doesn't repeat itself very often. So now what we're finding in the industry is a very competitive market. And that competition for your region is going to depend on the success of not only raising the standard of the quality, but your transparency and your ability to express the quality to the consumers, whether that consumer is a U.S. patient, a Russian patient, a Middle Eastern patient, or an Asian patient. So at the end of the day, we're talking about price transparency, quality transparency, the education of the patient, both in terms of what the quality and services that you have to offer, but also education of yourselves, education of the hospitals, the hospitality sector, the tourism sector, the government agencies, and that's really what we're talking about in terms of a healthcare cluster. I assume that I'm going to proceed without a PowerPoint at this point. So, bear with me. What I'd like to start about is this concept of clusters. What is a cluster, and what are the benefits of clusterization? For a healthcare cluster, or any cluster, let's start with that. A cluster is organized by various groups from coming together from different industries to have one single common goal and to develop one common message in delivering services. So when we look at healthcare, we look at that opportunity of the patient experience. We're not just talking about the healthcare experience, because we know if we offer the best standards of care to that patient, the best quality of care to that patient, essentially they're going to live through the procedure. But when they leave the hospital, are they going to survive their hotel experience? Are they going to have a bad experience in tourism? Has somebody provided to them a tourism opportunity that is inappropriate for their care? This is where the streamlining, the communication protocols, and the education protocols come into play. So I have some diagrams that I will show you in the end, hopefully. But what I want to discuss is that integration. Where do we fit in? We hosted the ministerial summit yesterday, and we had ministers of health, ministers of tourism, ministers of economic development, and the stakeholders of some of the heads of healthcare clusters, associations, foundations, and these are some of the names of what they're called. What these organizations have done is they've solidified what they deem to be their product in terms of health and tourism services and the delivery of those services to the expected tourism patients. And patients have different expectations than your typical tourism patients. And so I think that in integrating these industries, what you can achieve is not only the collaboration of the industries to streamline a strategic development plan, but also the ability to maximize that patient experience. So every step that patient takes, it's predictable, there's accountability, and there's a tremendous credibility that not only are they going to have a good experience, but moving forward it's going to be streamlined so much that that excellent patient experience is going to be communicated word of mouth. So their friends, their family members, their local press, they're all doing their part to promote the services and the experience that you have to offer. So I've worked with ministries of health, many of them in the past, and what they typically say is, our responsibility is to our local population. We're concerned about providing good services to our local people, and that is all part of the strategy. Ministry of Tourism, they're responsible for bringing people from the outside on the inside and guaranteeing an excellent hospitality experience. And the Ministries of Economic Development are responsible for looking for ways to become more competitive on a global scale and also seek new investment opportunities. Where is that investment coming from? It's coming from new healthcare facilities, new clinics, the rehabilitation and renovations of existing facilities, as well as new hotels, new travel agencies, new tourism opportunities, and all of this generates economic income for their respective regions. So just to get a show of hands, if you could raise your hand, I'd like to get an idea of who in the audience is from government or NGO organizations. Okay, hello Morocco. How about from hospitals, healthcare providers? Hospitality sector? All right, we won't talk about them. Oh, no, we do. Okay. And the travel and tourism side? Excellent. All right, so we will cover everything. Let's talk about the integration of these organizations. And since I don't have the PowerPoint to show you, I'm going to do some hand signals, okay? So what we think about is, here is your healthcare cluster. Your healthcare cluster is the culmination of all of these access points. And over here you have the Ministry of Tourism that's responsible for bringing people into the region and representing all of the tourism activities that are available. Ministry of Economic Development, which brings investment and opportunities in both sectors in terms of healthcare as well as tourism, and then the Ministry of Health. And the Ministry of Health is very important to have involved because they handle the licensing of the professionals, the physicians. They handle the licensing of any international physicians that are coming in to perform surgeries or to do training. They also handle any of the research and education programs that start to exist and the affiliations between hospitals, from local hospitals and hospitals abroad. And as you just heard about the importance of academic affiliations and practical affiliations, this is really how we start to raise the standard of healthcare for the local population. We could do this through clinical trials. Yay. We could do this through clinical trials. We can do this through strictly training programs. And I'm going to catch up here. And forward. Let me just continue with this, and I'll show you what I have, because I've got a thing going on here. So beyond that, on the tourism side, we have the hospitality sector. And that hospitality sector has your hotels, your hotel associations, your spas, and your wellness. And any of the training programs, certification programs that you may have locally there. Your economic development, of course, is your real estate development. We're going to talk a little bit about the baby boomers and retirement living and all of these areas of investment where we're going to think about the patient as not just the patient coming for a medical procedure, but picture somebody coming for tourism. They're coming for a vacation. They're learning their first experience of your culture, and then they're coming to you for their healthcare services. They get confidence in the healthcare system. They're very interested in the culture. They continue on. Now they're looking to buy some residential property, or perhaps they're looking to retire. We're going to find a place for all of our aging population and baby boomers. And this is where the economic development, medical equipment companies, the building of pharmaceuticals, and large corporations to handle the growing demand of healthcare services in the region. On the Ministry of Health side, you have your nursing associations, you have your professional associations, your physician associations, private associations of hospitals, and everything in terms of associations of cardiology and oncology and neurology, et cetera, et cetera. And all of those have their own licensing processes and procedures, and they stand to benefit as a stakeholder in a medical tourism industry. So picturing that, I'll show it to you in a moment. This is how we form a sustainable medical tourism model. So I'd like to be able to highlight some of these. So if you look on the screen here, it's a very long definition that I developed for sustainable medical tourism, but I think it covers really all angles. So I want to touch on each point. First, it's the delivery of high quality of health care. First and foremost, all of the studies that we have done showed that quality has to be as good as, if not better, than they get at home. So if you don't have the quality, it's not going to be a competitive environment. It is the primary source of patients searching for care. Now, focus on this, the services to local, regional, and international patients. So we're not just talking about building hospitals for international patients. That's not sustainable. What we're talking about is building hospitals for our local population to serve the needs of the local population and all of their conditions, whether they be non-communicable diseases or communicable diseases, and treating them first, and then looking for the next lowest hanging fruit, which is the regional market. So if we're talking about a Latin American program, we're looking at other Latin American countries, the Caribbean, and in the Caribbean, it would be an intra-Caribbean region. And many of the Asian providers look to the Asian market first, and then they expand from there. And then we look at what excess capacity do we have to suit the international clientele. That's where we say this is the surplus. This is the area where we have empty beds, and we have opportunity to be able to fill those beds in areas of expertise where we have good outcomes and excellent quality and the ability to handle those. We never neglect the local and regional patients because, again, that is the most sustainable model while we develop the international brand. So as a hospital, you have a local brand. You may have a regional brand, but in developing the international brand, this is going to take time. If you attended any of the marketing sessions or social media sessions, you'll learn that this is a long-term investment in branding. It doesn't happen overnight. You cannot hang your sign out and just expect that people are going to come in. It's everything from internet presence to developing relationships with referring hospitals, referring physicians, marketing at international events, creating the B2B relationships, as well as establishing a business-to-consumer relationship through word-of-mouth reputation. So it has to be organized strategy. It's very challenging to do what Bumrungrad Hospital was able to do through one hospital, marketing themselves, branding themselves. The benefit of working through a healthcare cluster is working collaboratively and doing that branding together, because the organization of that lends to the credibility of your program. It has to be a long-term strategic approach. So it's not something that's going to happen overnight. We're looking at the long term. What is our 1-year achievement? What is our 5-year achievement? What is our 10-year achievement? It needs to rely on service development, both in the healthcare sector, travel sector, and hospitality sector. Niche marketing. Niche marketing. This is a niche industry. These are people that not only need services, but they're willing to travel for it. Not everybody is appropriate for medical travel or medical tourism. Many of them aren't fit for travel. This isn't emergency care. We're talking more about elective procedures with people that are looking for the alternatives based on that value proposition that I presented. The message needs to be continuous. So what we've been able to see, we've seen a lot of, is that some people come, they start promoting themselves, they haven't guaranteed necessarily their budget, they haven't developed a strategy for the long term, and so it's a mixed message signal, or it's a signal of one provider or facility as opposed to a group of facilities. So that message needs to be continuous over the period of time for the duration of the strategic plan. It needs to achieve steady growth. We want to look for that steady growth. What that means is we're looking for the measurements of the results. So we need to gather the data from our members, from our hospitals, from our hotels. How many people are traveling? What are they traveling for? How much are they spending, and how long are they staying there? That is the steady growth that we can report back and therefore continue a prosperous program. It has to endure market fluctuation as well. So economic climates, political environments, et cetera, will all have an impact, and increased competition. You've seen somewhat of a United Nations in the exhibit hall. You're seeing more and more countries each year start to participate in the industry, so the competition is rising as the quality of healthcare continues. So what I was mentioning, this is the value proposition, and this is globalized, and it's regionalized. So the cluster economy, obviously, they're considered to increase the productivity, and this can complement any existing programs. Essentially, what we're trying to do is to eliminate competition, but it allows competition on a global scale. What I had mentioned before, the benefits of cluster business, is this profitability and strategy that you develop, and the ability to position yourself as a region and support the global economies and industries. Again, the hospitality, the tourism, and the healthcare side. Some of the other benefits of cluster business, even though it's a new way of thinking, it's aligned with typical competition. We are competing regionally, so clusterization is something that happens in basically all sectors of economy. It creates a linkage of resources, so you can share resources, the technology, the skills, training programs, all types of information, the marketing strategies, and it combines the private sector, the government entities, and the associations through an education and research-based organization. So what some of the case studies that I'm going to show you in a moment, a lot of this involves changing the policies and procedures that are currently going on in terms of the collaboration between the health and tourism sector. But many countries have actually changed laws to support medical tourism and development, and I think that you're going to hear some case studies such as Lithuania and Turkey that will give some examples of some new laws that have been put in place that benefit all sectors of the area. Basically, not only through funding, but marketing and promotion and reimbursement plans for the public and private sectors. So what we try to do in developing the clusters is really to create standards. Who can play in this space? If you imagine, we don't want to be having everybody necessarily participate unless they're willing to implement international standards in terms of patient safety and quality, and also things like accreditation, setting timelines for implementing these international standards, timelines for getting accreditation and training programs in place. You can also focus on the productivity and profitability, some of the other non-financial growth, giving back to the community by working as a cluster to generate excess revenues or to create competitiveness and raising the standards of healthcare. We're also able to give back to the local population through things like educational programs for non-communicable diseases, a greater emphasis on wellness and prevention. These are areas where the cluster gets the support, can get the greater support from the government by giving back to the community. And then, of course, you have that data for analysis. So you can promote this, you can make it visible to buyers throughout the world, and this lends to the credibility of your initiative. So we're going to focus on each of the different aspects. For governments, for instance, their participation is in developing some of these economic policies to develop the cluster business. They are recommended to serve as advisors and to carve out a path for the industry players, to support the industry players, whether they're private or public, to show them that they're supporting and they're lending credibility to the initiative. They can provide the tools, the resources, the training programs. We have some train-the-trainer programs that are put in place, and this is sometimes done at the government level. And they can also serve as a facilitator for all of the programs moving forward, including the marketing and branding on an international scale. So some of the healthcare clusters that I worked with, what we decided to do was some of these results. And this is really sometimes challenging because you have these people and these hospitals and these doctors and these hotels that are traditionally competitors. And getting them to put their competition aside can be a challenge, but it's not insurmountable. So the goal is to develop common goals, to create that one message, that continuous voice as to the quality and opportunities, as well as to understand those challenges and threats and to be able to appropriately manage them should they come up. There's national and international structures that can be developed. Again, the changing of laws, the implementation of international standards, the quality practices, through development of international patient services and other types of protocols that are put in place for all the members of the cluster. Improving healthcare infrastructure. This may require some changes or adaptations of existing infrastructure to, again, streamline that patient experience. And then looking at some of these competing organizations and getting them to work together, participating, can also solve some other internal issues that you may have, which are competitive in nature, and then taking that regional brand and turning it into an international brand. So through the data analysis and gathering of data, that's where you're also going to be able to set benchmarks. So the Medical Tourism Association is doing some destination ranking, and through the International Healthcare Research Center, which is our research arm, it's a 501c3 charitable organization, we have found that there is not enough data out there that has been combined into one good report. So what we're looking to do is not only provide an industry report, but be able to provide a country-by-country report to be able to show and how they benchmark with each other. This is the chart that I promised to you in terms of some of the current medical clusters. And these are countrywide. You're also seeing citywide. You'll see that we released the Miami Destination Guide recently. We've done the Las Vegas Guide. We also released the Jordan Guide. So this is a growing trend in the collaboration of healthcare providers combined with the tourism sector to be able to deliver that message. Through our destination guides, They're not only a printed publication, but they're available online. And this is useful to be able to communicate that message, not only from a B2B level, but B2C level. And so you see this list is growing. Every time I produce it, I think next year I'll be on to 2 slides. It doesn't have the 80 countries I was talking about. So this was the graph the chart that I was talking about and how they're interrelated. And then the idea is that this medical city or this healthcare cluster combines to do some of the things that you'll see on the left-hand side. Sorry. These educational workshops for providers, certification programs, familiarization tours for facilitators, but also insurance agents, insurance companies, brokers, and TPAs, and also international conferences. And basically what this is designed to do is build the program that is a sustainable program based on education and develop it, solidify it, create credibility for it through certification programs, and then bring in the buyers for familiarization tours so they can say, I saw it and I believe it. And then they take that message back. Many people think that the insurance companies are the ones that they need to approach for medical tourism. But at the end of the day, the people that are really pitching your cause, it's the agents, the brokers, the TPAs, and the consulting firms that have all of the employer clients. And what they do is they need to create cost benefits for their clients. And so medical tourism provides a really unique opportunity to creatively develop some cost savings for those employers. So again, these benefits, this is a summary of all the benefits. Many of the healthcare clusters set price ranges. They control who is in the game. They have language requirements, meaning on their websites they may have it bilingual or trilingual, and all of the members are to comply with that. But in the end, I think one of the most important things is this, the control over the reputation and bad experiences. Because 1,000 good experiences you'll hear about, but one bad experience you'll really hear about. So what we need to do is damage control. We need to figure out as a group, how are we going to deal with these complications or if something goes wrong? Because in the end, medical services, they're not perfect. Something will go wrong, and how are we going to handle that? And the professionalism that we use in handling that will create that credibility, that confidence, and the accountability. And that's really one of the, I think, the greatest benefits of working in a healthcare cluster. So I'm going to go through these slides very quickly in terms of the case studies. But these are some countries that you're familiar with, Singapore, and I listed a lot of information. What does Singapore have to offer? They have, the population, they're known as a first world country. They have an English-speaking environment. It's considered one of the world's easiest place to do businesses. It's very modern. I've been there myself. Logistically, it's strategically placed to be able to attract patients from throughout Asia, but also internationally. And they're considered to be the second most technologically ready nation. So as an example, this is one of their claims is they create a healing environment coupling high-tech capabilities with high-touch service quality results in some of the highest levels of patient-focused healthcare services available in the world. And that is a long way of saying we do it well and we do it right, and our patients come back for more. Their accreditations, you'll see that they have 80% of their tertiary care services. You'll see, they've got clinical specialties. They've got internationally qualified doctors that come from all over the world. They have a unique model where the public sector is integrated with their national plan with the private sector. So in the private sector, you'll find that many of the hospitals have a certain price tier for services that are a little bit elevated. And in the public sector, those same doctors are performing procedures in public hospitals, and they can do so at a lower price. What that does is it creates diversity. It creates diversity in the types of patients that they can attract. They can attract the price-sensitive patients, and they can also attract the patients that are looking for brand recognition of the hospitals. Some of their tactics. Okay, so the Ministry of Health here is very involved. They maintain strict quality of care standards. So the clinical outcomes have to be reported. They are constantly benchmarking themselves to keep themselves competitive. They're public healthcare institutions. They're constantly doing training programs. They're traveling throughout the world to see what is available and how they can raise the bar, the next bar, and raise the next standard. They have a lot of collegial relationships and academic affiliations, and they see this as a cross-collaboration that is extremely beneficial for their growth. Let's talk about Jordan. So we have been very fortunate to be able to work with Jordan almost since the beginning of their medical tourism platform. Now, while they have received a tremendous number of international patients due to their high quality and the logistics of where they are geographically, they had the support. This is a unique relationship. They had the support of USAID. And USAID basically provided them with some funding and some guidance and created a certification program called HCAC, the Healthcare Accreditation Council. And that Healthcare Accreditation Council is now being accredited through the ISQA. So it's formatted on Joint Commission International, which has also accredited their hospitals. ISQA is the International Accreditor of Accreditation Systems. So ISQA accredits JCI, ISQA accredited HCAC, which is now their national accreditation scheme. And moving forward, HCAC is looking to internationalize their own program to be able to offer it to other countries. So it's a large program. USAID has withdrawn from their support, but the Jordanian Private Hospital Association continues to thrive by doing their training programs, their conferences. We've worked with them on familiarization tours. We just this past April organized a conference there. And you may have read in Medical Tourism magazine a lot of what they're doing regionally, which is the bulk of what they're doing in international patient flow. They're treating a tremendous number of Libyan and Syrian patients due to the conflicts there. And they did so between the relationships with the governments. They also have a lot of trade missions that they do in sub-Saharan Africa to establish relationships with the health consuls there and to streamline some patient flows through some of the other regions. Some of the quick facts: they have 7 internationally accredited hospitals. They have literacy rate that's very high. There is literally no language barrier. One of the most interesting thing that I found was this. More than 90% of the physicians are educated internationally, but the largest percentage, the ratio of those physicians coming back home and practicing in Jordan is extremely high. And that's where we're seeing a lot of brain drain in some of the nations, where people, they go, they become educated, they get their medical degrees, and there's not a lot of incentive to come back home and to treat the patients. But because of the high standard of quality of care that the Jordanian hospitals offer, they're coming back to good quality hospitals that create sustainability for them to return home, and they're very interested in being able to provide services to their local population. Here are some of the tactics. It may be difficult to read in the back, but essentially there was a dedication from the Ministry of Health. For those in government, this is one of the crucial points. There was a dedication from the Ministry of Health to determine Jordan as a medical hub of the Middle East. And that was significant, as was the USAID input. Their competitive pricing and their high quality of health services has always attracted regional patients, and as I said, in North Africa and within the Middle East. But they're continuing to track their data and collecting information from the members of the Private Hospital Association, which is spearheading their program, to show their competitiveness. And they make this information available to the world. And this, in and of itself, makes them a desirable destination for medical tourism. So in developing your plans, I really strongly recommend that data piece is important, because not only for yourselves to be able to show the success of your program, but also to be able to really to show the entire world obviously, what you're accomplishing. South Korea is another very good case study. South Korean government had established an organization that had started with about 30 private hospitals, as well as some public university hospitals, and they created the Council for Korean Medicine Overseas Promotion, and it was known as KITI. And they've basically combined with the Korean International Medical Services Association, and there's a branch of that within the U.S. Through this collaboration, it became a national priority. Now, they had the challenge of having laws that basically became an impediment to the marketing for hospitals and doctors to market themselves. There was a law prohibiting it. So they changed that law. They allowed the doctors and the hospitals to promote themselves, and they developed as a requirement that anybody that's coming in contact with these international patients must report back to the KITI-KIMA group, the healthcare cluster, so that they can track that data and report their results. So that was licensure of travel agencies and medical tourism facilities, again, controlling that program. Korea has one conference every year on medical tourism, and they continue to organize familiarization tours. Specifically within the United States, they're doing a lot of patient flow, working with some corporations that have large Korean populations. And also they're looking into the Russian market and also the Asian market. And they're establishing relationships with the referring physicians, bringing some of those hospitals and referring physicians into South Korea to train them in areas of medical expertise. And why is that sustainable? It means that they're always going to have a source of referral of patients for those very complicated cases that can't be handled locally. But they're providing the knowledge base to train those doctors so the standard of healthcare is also raised in countries like Russia and Ukraine. So it's almost becomes a triage relationship where those doctors will contact the hospitals in South Korea, and they'll say, we have a patient with this type of condition, what are your thoughts? Now that Korean physician may say, well, I think it's something you can handle because we've trained you on that. Or they say, this is more complicated and I think it's something you should refer to us. It creates trust, it creates steady flow, and this is one of the successful tactics of U.S. hospitals. So, medical tourism zones. This is something that is a growing trend. It's basically a free trade zone. It's usually called a healthcare free trade zone or healthcare city. And what we're talking about is tax breaks. So many of these are being developed in regions around airports. They're also in regions that have been underdeveloped in terms of the healthcare sector. But there's a large opportunity to bring medical devising, medical equipment companies, and some investor groups in to say, we can build it here. We're going to build a healthcare facility. There's tax breaks or no taxes at all and some tax incentives. There's typically duty-free importation of medical devising and medical products. And what this does is lowers the operating costs and creates a competitive opportunity for the healthcare providers. The benefit is obviously it encourages this investment. It builds up the healthcare infrastructure. It allows for the development of medical clusters and healthcare clusters within new regions that currently didn't exist. And then the benefit is the national and international patients. So again, we're focused on our national, regional, and international patients. One of the good examples is what's happening now in Turkey. There's a Turkish project for a health tourism free zone. And establishing this is going to happen in some of the major cities such as Istanbul, Izmir, Antalya. And they're talking about 2 or 3 by 2014. That's a short period of time, but I know they're moving very quickly. And as I mentioned, Amin Çakmak will be presenting in the case study some of the information about what the government is doing to support the medical tourism or international healthcare initiatives. But just as a summary, they have changed some laws that support the Turkish hospitals to travel overseas for international conferences. and exhibitions, and they do a reimbursement for some of their investment. They are providing reimbursement for trade missions to a certain percentage, sometimes up to 70% reimbursement in the private sector. And they also have another law that's been put in place that benefits those hospitals that are looking to develop clinics and hospitals abroad to serve as referral centers for patients back to Turkey. So it's a really interesting model. I encourage you to attend that session. And then again, you'll hear from Lithuania and the Ministry of Economic Development on that. The model is based on Dubai Healthcare City Free Zone, and what they're planning is this 50% tax reduction, less government intervention, and increased freedom for investors and companies. Dubai Healthcare City is a project that started quite a while ago. It was launched in 2002. It is now the home of 2 internationally accredited hospitals. There was a little bit of delay due to the economic conditions in terms of some of the development, but Dubai Healthcare City has now gone, I'm sure you've seen it in the media, really full-born in terms of developing strategic relationships for not only sending their patients from Dubai through the Dubai Health Authority to regions for high specialized care, but doing that academic exchange and the informational and training exchange so they can build up the quality of their services. They have over 2,500 licensed professionals, and they speak over 40 languages. Really, they're looking at this being an international hub for healthcare within the Middle East. The DHCC actually offers 100% tax-free income, 100% foreign ownership, no corporate tax, no income tax, no restrictions on capital and clinic lease. So again, it goes with that motto, welcome to Dubai. The support, they've got fast-tracked company registration. The immigration is very easy. Their licensure of international physicians has become very easy, and it's very close to the Dubai International Airport. So when we talk about some of the rules and regulations in creating some of these zones, we really need to focus on how to attract business and how to make it a sustainable business. So they look at how to make it easier for internationals to do business there. Some have enacted regulations that are not non-friendly. So essentially, it discourages people from using the zones, and therefore it's not successful because they're trying to keep it within the region. And ideally, if you're building the zone, you're looking for that outside investment. And so the success really is not only in developing it, but really broadcasting that to the international environment and seeking those relationships for investment, not only just from property investors and builders, but looking at it from the perspective of those synergistic relationships between other healthcare providers that can train and provide the super specialized services that are lacking in the region. Some of the challenges are the logistics and licensing and quality. How do you maintain the licensing? Some of the doctors and nurses, they have different training. The licensure has become quite a problem in some of the regions we've been looking at. For instance, I was recently in the Caribbean. One of the island nations said, we'd love to be able to build this new hospital that's been talked about. The Ministry of Tourism is on board. The Ministry of Health is on board. But we've got to change some laws here. It's almost impossible for doctors to come abroad and practice here. So it makes it challenging to create those relationships to improve the services. The other consideration is to import or not import. So the expense of importing doctors and nurses, we need to focus on our local talent, training our local talent first, retaining our local talent, and not resulting in a brain drain so that we don't have to import too many of those services. So some of the issues that we find to sustainability in any of the concepts that we've talked about in terms of the healthcare zones, the medical cities, or healthcare clusters, is that lack of roadmap or strategy, the lack of a long-term approach to bring the international patients to be able to measure them, to be able to maintain that quality of care, and manage the expectations. So you can build it, but are they going to come? You can't just build it, open the doors, and expect people to come. The long-term strategy has to include that constant, continuous message of what that value proposition is for each patient, and not a generalized one, but specifically targeted to each target market that you're looking to enter. And again, that may be your lowest hanging fruit as a short-term project, then you have your middle term, and then your long-term projects. But the branding and the messaging has to occur for all of those target markets through the duration, because obviously they're going to have their own challenges to overcome any preconceived notions of what the quality is. Perhaps if there's a longer distance of travel involved, we have to step out and we have to give that message. So how do we solve this? Of course, the master plan needs to be developed. It has to be a strategic approach to attract the patients, to create the brand for it, to have the support from the whole sector, the tourism sector, the investment or finance and economic development sector, and the health sector, so that that message is continuous and that brand doesn't falter. And then this is a new consumer awareness. How are we going to access the consumers? So we can develop the B2B, but we also have to have a message for the consumers. So just to summarize, for the medical tourism impact, there's benefits not only for global healthcare, the governments, for the country or the city, and all of the supporting industries under the healthcare, the tourism side, the hospitality side, etc. Our role through the Medical Tourism Association is to advocate transparency in quality and pricing, to advocate communication amongst yourselves and communication with the end user, which is the patient, the insurance agent, the broker, and the employee, and education protocols for all. Education of ourselves to raise the standard of the services we're delivering, and education of the patient so they know what you have to offer, we're managing their expectations, and we're delivering that streamlined patient experience that makes them want to come back for more and recommend you to everyone else. These are our tenets, and I would suggest that these are the goals of any healthcare cluster or healthcare city moving forward, that they initiate the strategy to support these same underlying principles. So while your product is going to be unique, and you can color it as you will and as you want to, and you can adapt it for your culture, for your target markets, etc., in the end, we're talking about the patient experience. So thank you for your time. I apologize.